Good afternoon. Thanks for joining us. I'm Brian Blackman, Sustainability Director for the City of Knoxville, and I'm the facilitator for the visionzero process. I've got some members of my team here, Grace Levine over there, who will be handling Q&A and questions, and then in the back we got Dawn Michelle Foster checking everyone in, my Deputy Director. So, transportation safety is something that is not new. Obviously, a lot of people are interested in it from different perspectives, whether you're in a car, whether you're on a bike, or whether you're walking. And whenever we kicked this process off, I'll be honest, I didn't have a whole lot of expectations. I needed to have a lot of information dumped into me. So when we started in February, we've spent since then several months talking to many of you in the room, as well as doing surveys and learning more about not only fatalities, serious injuries, community comfort with where you feel safe traveling, as well as getting downloaded on the data. So as we started having those conversations, I started looking around the room at all of our partners and saying, we've really got to go ahead and start this conversation. There's a lot of information to unpack. There's a lot to learn. And the sooner we start that conversation and educating folks, the better, before we get to workshops and work groups and all the fun hands-on stuff that might be a little bit we'll say too in the weeds for most audiences if you haven't had this sort of background. So this is the first of many conversations and the first of many public education commitments that we'll be going into. And probably in July or so, we'll be kicking in more campaigns to get more information out to a broader audience, as well as many of the members of the steering committee that are with us today. So today we've got a panel, and we've done our best to try to present a wide array of perspectives. So they're going to be doing most of the talking. If I feel like I'm rushed or you feel like I'm rushed, that's mainly because I want the experts to speak. You don't need to listen to me for a full hour, and I'm going to save as much time for Q&A as possible. So a couple of points of housekeeping. For restrooms, if you've never been here, out the door there's a little hallway, there's men and women's restrooms out there. We'll also be having multiple ways to answer or ask questions today, since we're kind of time sensitive, and if you're like me, you get into the middle of someone's presentation and you go, I've got a really good idea, I can't wait to ask that question. The next presenter goes, and probably by the third you've already forgotten your question. So we've got cards. You can write your questions down, you can ask them, you can hand them to Grace. For anyone that's joining us online, we are using slido.com. There'll be somebody watching the chat to be able to post that link so that you can send a question in so that we can monitor and track those and make sure if we can't answer it during the meeting today, we will follow up with you and answer that question and make sure we address those. Any questions about that? Great. So, and a little bit about visionzero. So one of the things that we've heard from this is visionzero is, unless you're familiar with the jargon, it is something that maybe is unintuitive to hear. But the basic premise here is that no fatality, no serious injury resulting from a crash is acceptable, period. And we need to do better to advance safe transportation of all modes of transportation, and do that with a sense of equity and understanding the historic context of the neighborhoods that we're serving. So just a summary, those are kind of the core principles. If you take nothing away from today, understand that. Real quick run through on kind of a timeline. So I talked about, we've been talking to stakeholders, we've been doing interviews. February we kicked off. This is where we're at today, education panel. These are still ongoing, the interviews with stakeholders. So if you've not talked to us and you feel like you really need to sit down and tell us what needs to be done better, feel like you can reach out to any one of my staff. We'll schedule something, we'll sit down and have that conversation. In June, we'll be doing an update to debrief the steering committee on all of those findings. So we will be posting those meeting information online, and you can track it there as well as on social media. And then in this fall, we'll be starting public info sessions, ways for general public as well as steering committee members, any interested party really, to get involved, get hands-on, and weigh in on how they can make the streets safer. Perfect. So I'm just about right on time. Before I hand it off to our first speaker, I'll do a really quick introduction for each. So first we'll have Brian Hill Brian Hill is an award-winning community planner and activist. Brian's led the development of local and regional strategies to improve parks and recreation, transportation, land use, environmental protection, and economic development. Brian serves as the Vision Zero chair for Bike Walk Knoxville and will be sharing insights into the Vision Zero approach with some examples from other communities. Next, we'll hear from Ellen Zaviska, who's a principal transportation planner with the Knoxville Regional Transportation Planning Organization. Ellen's been with the TPO since 2005 and has been a critical part of multiple bike ped and greenway plans. I'll say that from my own perspective, she's been foundational in improving our local data quality around crashes, I would say specifically bike ped, and developing deeper insights into prominent patterns, their locations, and solutions. And she'll be sharing some of those insights with us today. Following Ellen will be Harold Cannon. Harold is the engineering director for the city of Knoxville. He brought 39 years of private sector experience when he joined the city in 2020. His staff oversees the design, construction management of all street, bridge, greenway, park, public facility, and drainage projects. Harold will shed some light into everything that goes into creating safe mobility systems for a multitude of users. And then our final speaker will be Lieutenant Tammy Debeau, who joins us from Knoxville Police Department. She has more than 20 years with KPD and brings a wealth of experience from her time with the Safety Education Unit, as well as being the previous director of KPD Training Community. She will share the law enforcement perspectives and the teeth behind many of the policy decisions like speed reductions and other programs that are related to keeping our streets safe. So I'd like to hand it off to Brian to take over and drive us on Vision Zero.
You have come up there?
Please.
Thank you. Good afternoon. I'm here today to provide you with a vision for Knoxville, the safe and vibrant place where people feel comfortable to move throughout the community without risking their life and their safety. Vision Zero, as was very well introduced by Brian, is an international grassroots campaign. It moves from city to city, from community to community, with the simple goal of bringing deaths and serious injuries on a roadway to zero. It's different from other traffic safety campaigns because it's based on a simple goal of zero, and it's collaborative. It brings together all users of the roadway to come up with solutions. So who am I? I'm Brian Hill, as was mentioned. I am a Knoxville resident, a certified urban planner, and the Vision Zero committee chair. I previously served on the board of Bike Anchorage, and I helped them develop the Anchorage Vision Zero campaign in Anchorage, Alaska. I have been working with Bike Walk Knoxville for the last 5 years on developing campaign strategies. We started meeting with electoral candidates during the most recent mayoral election and got several of them to commit to Vision Zero as a platform for their election, and have been pushing for Vision Zero since Mayor Kincannon was elected. And as of October of 2021, we helped them craft and pass a resolution to that end. I also want to mention that I have personal interest. I am a personal survivor of a collision that nearly took my life. Lost metal rods and pins running from my hip to my heel on this leg, so pretty substantial injuries. So I come to this with personal experience in this world. So what is the challenge? You know, just looking at it from a high level, there are over 1,000 roadway deaths in Tennessee each year. In Knoxville, within Knoxville itself, over 100 injuries and deaths annually, and 30 plus bike ped injuries and deaths annually. Children and elderly are a large number of the vulnerable on our streets. You know, when you look at it, only 2% of total collisions on our streets involve a bicyclist or pedestrian, but over 1 in 5, 21% of the deaths are suffered by a bicyclist or a pedestrian. So what is the vision? What do we do about this? As was so well introduced by Brian, Vision Zero provides a different platform. It starts with principles that are different from any other traffic safety campaign. It starts with the premise that all deaths and serious injuries are unacceptable. It says that humans are vulnerable and that humans make mistakes and responsibility is shared. We need to make safety proactive. And if humans make mistakes and they are vulnerable, and if responsibility is shared, then we need to create a system that is redundant. I also want to stress that, again, Vision Zero starts with that data-based goal of saying we are going to get to zero, and we're going to take a data-based strategy to get to zero. Ellen will talk to you about some of the data-based strategies in more detail, but because of that goal that is very concrete, we can actually measure our progress as we go. And in cities across the US, places like New York, San Francisco, Boston, we've seen fatalities on the roadway in traffic and to bicyclists and pedestrians in traffic decreased by up to 30 or 40%. And in fact, on average, the major cities with Vision Zero policies saw 32% decreases in traffic fatalities over just the first 5 years of their campaigns. So this is unprecedented. We haven't seen this kind of success in any other traffic safety campaign. In addition to this, it has spread like wildfire. There are, I believe, about 50 recognized Vision Zero campaigns now across the country. They are all grassroots campaigns, so it starts with the highest elected official declaring Vision Zero, like we did here in Knoxville. These campaigns stretch from coast to coast. They are in different geographic areas. They are in different size communities across many types of densities and political affiliations. So it's not just one type of community that's doing this. And we're seeing some substantial success with mid-sized cities as well. Places like Durham, North Carolina, Fort Lauderdale, Columbia, Missouri, Anchorage, Alaska, where they're developing stronger partnerships, implementing low-cost solutions, reducing speeds, safer infrastructure, and getting positive citizen feedback. So what's the action? The call to action. Really, creating a Vision Zero campaign takes 4 steps. It starts with the political commitment. That refers to the commitment that was made by the city with the resolution in October of 2021. Then a steering committee is formulated. Much of the steering committee here is here today. And we want that steering committee to be diverse and representative in order to assemble a plan that champions those who are most vulnerable. Then an action plan is generated. That action plan must be a roadmap to get us to zero and should look at both low-cost and long-term solutions. And then finally, last but not least, implementation. Strategies must be equitable. They must address high-priority areas first, and roadway design and speed must be paramount. So how do we develop the action plan? Now, an action plan for Vision Zero is like any action plan. You have to answer 4 fundamental questions. Where are we now? Where do we want to go? How do we get there? And how do we measure success? In reference to the Vision Zero plan, where are we now? That's looking at robust data. What's the best data around where we are and what's working, what's not? Again, Ellen Zawiska will present a lot of the robust data that's already been collected. Then where do we want to go? That's about developing goals and timelines. We want to be very concrete in how we're going to get to zero, when we're going to get to zero, and what strategies we can reach for that are low cost and quick, as well as those long-term strategies. How do we get there is all about accountability. We want to make sure that we're identifying who's responsible for those actions and how we're going to get them the resources to make them possible. And then finally, last but not least, transparency. We want to tell the public, we want to tell everyone what we're doing, how we're doing it, and how that's going to get us to a safer community. Identifying short-term actions is a huge portion of this action plan. So we want to look at things like leading in pedestrian intervals and bicyclist intervals that allow pedestrians and bicyclists to get out into the intersections first so they can be seen. Temporary furniture in certain street areas to take back the streets for different activities. Things like flexible posts and paint on the streets to tighten intersections and make places feel safer for all modes. And then looking at long-term solutions, things like creating complete streets. I know we have a complete streets policy here. Tightening up turning radiuses with permanent facilities, widening sidewalks, adding mid-block crossings to make places feel safer. Ultimately, we want to make sure that all of these approaches are incorporated into a safe systems approach. And the safe systems approach looks at all aspects of roadways, including the roadway users, the vehicles using them, the speed limits, the design of the infrastructure and roads themselves, as well as the post-crash response. And it says it's not just the responsibility of those using the roads to maintain safety, it's the responsibility of all of us. So we all have to work together. Responsibility is shared across the system. And we want to look for those areas that are high risk. rather than just looking for places where we've had accidents or crashes or wrecks in the past. We want to look for those areas where there's high risk and address those areas up front so we can prevent the collisions from occurring. This is not just a slogan, it's not a tagline, it's not even a program. This is going to take all of us working together. It is really a fundamental shift of all agencies working under the leadership of the Mayor's Department, of the Department of Sustainability, and of the Mayor's Office, in creating a paradigm shift. We want to create a culture of safety. Again, it starts with city leadership, and we have seen so much city leadership over the last months leading up to today. It involves all of us, so we all need to work together on this. Again, we are just trying to create a paradigm shift here in the way we think about safety, and we really look forward to working with all of you on this campaign. Again, we are Bike Walk Knoxville. My name is Brian Hill. I'm the Vision Zero Chair. It's been an honor presenting to you today, and I look forward to working with you all as we move this campaign forward. Thank you.
Thank you, Ryan.
Thank you, Brian. All right, well, thank you so much, guys, for setting the stage. I appreciate that. And I am, again, Ellen Zavitska, serve on the staff of City County Planning and the Regional TPO as a transportation planner. And I'll be talking a little bit more about what we know from the data, talking about what it means for equity in the city. Start off with a little bit of a sobering chart here. This is the trend in traffic deaths in just the city of Knoxville. The purple bars are the number of traffic deaths every year. You can see in 2021 we had the highest number in 19 years. That's as far back as our data goes. The orange line shows the share of traffic crashes resulting in a death. So if you're involved in a crash, you know the proportion of those that involve a traffic death, and that also spiked in 2021. So as I said, this is sobering information, but this is really the time for the city to be doing this, and so I applaud this effort very much. That we're taking this systemic Vision Zero approach. The good news, if there is some, is that we know these crashes aren't random. We know where the preponderance of them occur. And it's a handful of corridors. So the list you see there, these are the corridors that see the greatest number of fatal and serious injury crashes per mile. In Knox County, of course, a big share of these roads is in the city of Knoxville. So that tells me, we can wrap our arms around this. Not that these solutions are simple, not that it happens overnight, but we know where the huge proportion of these are happening, and we can address them. And of course, the state DOT is going to have to be involved in these because these are state roads as well. So one more chart here. These are the corridors where we see a huge share of people hit who are walking and cycling, and where we see most of the fatalities of people walking and cycling. It's virtually the same list. So again, if we can wrap our head around, these handful of corridors, we can make a huge dent in this problem. While we're talking specifically about people walking and cycling, want to focus in on some of the equity issues there. So we know from national data that seniors are far more likely to be killed as pedestrians in traffic crashes, and that risk increases with age. We also know, again, from national data that especially Black and Indigenous people are much more likely to be killed in traffic crashes. That's probably the result of greater levels of exposure due to poverty. And we see the same patterns here in Knoxville. So the top number is showing the share of pedestrian crashes that involve people who are identified as Black or African American in the city. They're much more likely to be involved in those crashes based on population. And then at the bottom, we see that seniors are, on the one hand, less likely to be in crashes, but more likely to be killed or seriously injured in traffic crashes. Again, just probably greater vulnerability to those injuries. And a lot of this has to do with the level of exposure, with who's walking and cycling and where. Knoxville is I think most of us would agree, a pretty car-dependent place. Most people use cars to get around every day, but we still have a large share of the population in the city of households without access to a car. Across the board, it is more than 10% of households that have 0 cars. That's about 9,000 households in the city, and that doesn't even account for households that have more drivers than vehicles, younger people who can't drive, people who outgrow their ability to drive or can't drive for other reasons. So when we have a city that's very car dependent, very oriented around accommodating car traffic, that puts these folks at much greater risk. There's also just a tremendous cost to this. That's a big barrier for car ownership. So this is an estimate from AAA that it costs more than $9,000 a year to own and maintain a car, and that's even before gas prices spiked and cars became so much harder to come by. So it's just a huge cost burden on especially low-income households to own and maintain a car. Many of them take that on anyway because they don't have other ways to get around, to get themselves to work, to get their kids to school, to meet their daily needs. And so we've seen in the last 10 years this doubling in auto-related debt in the United States as a result of people making that decision. Now, auto debt's almost equal to student loan debt and has doubled the amount that is owed by credit cards. Talked a little bit earlier about seniors, folks who age out of being able to drive. AARP estimates this is on average 10 years, the last 10 years of life. People aren't able to drive for various health reasons. And that is putting a tremendous burden on those households, on their families. When people, again, live in a pretty car-dependent place, can't drive to get around. It also means an increased risk. A lot of people are really incredibly reluctant to give up those car keys if it means that, they don't have a safe, comfortable, dignified way to get around. And that puts them at greater risk. It puts everyone else on the roads at greater risk when we don't give seniors and other folks a safe and healthy way to get around. So I've got one last slide to share with you. I've talked a lot about data and numbers. For those who've been touched by traffic violence, I think it's important to remember that these are not just data points. I'm going to show you some images, and this is from a slide I put together every 6 months. These are faces of people who've been lost to traffic violence in Knox County just in the last 6 months of 2021. And as I mentioned, I put this slide together every 6 months because we have a group that meets twice a year to review traffic fatalities in Knox County. Law enforcement's involved, engineering's involved, public health is involved. A lot of different voices and organizations are at that table. And we talk about all of the traffic fatalities in Knox County. We talk about, what everyone brings to the table, the information they bring to the table, what might be done to prevent these. We've learned a lot about the role of substance abuse in these crashes in Knox County. 50 to 60% of traffic fatalities over the last couple of years have involved substance abuse, and that's an issue that goes well beyond what we're used to dealing with in the transportation world. It's not something that planners and engineers are typically trying to deal with, nor are we experts in it, but it's a huge impact, and it's just indicative to me of how complicated these issues are, how they go well beyond the typical realms we're working in, but we need to be working outside those worlds, and again, taking that multidisciplinary approach to traffic violence in Knoxville. So that's what I've got. Thank you.
Thank you, Ellen. Harold Cannon, the Director of Engineering in the City of Knoxville. I think this was staged because did you hear how many times Ellen said senior, senior, and then I'm up here. But we'll roll with it. We'll roll with it right now because it's true. It is true. I wanted to show you on the first slide what the Engineers Creed, based on the National Society of Professional Engineers, believes and practices. And you talk to any engineer worth their salt, they will recite this to you over and over and over. our focus is on the public health, safety, and welfare of our community. That's been in our creed for decades. But I want to read you something that has not been, and I would guess 10 years ago may not have been there. This is the American Society of Civil Engineers, which I and most of our staff here are civil engineers. On the Code of Ethics, it says, first and foremost, protect the health, safety, and welfare of the public. Sounds familiar. But you go up to the preamble, and for me, this is where it becomes fun. Create safe, resilient, and sustainable infrastructure. Treat all persons with respect, dignity, and fairness in a manner that fosters equitable participation without regard to personal identity. Third bullet point, consider the current and anticipated needs of the society. And last, utilize our knowledge and skills to enhance the quality of life for humanity. That's a broad net, and it's one I'm very proud of. And it is one that would not have been, I don't believe, here probably 10 years ago. But we're seeing the difference that we can make together. We are better together. We don't do very well when we're in our engineering silos, when planning is in a silo, when bike, pedestrian, accessibility communities are in silos. We get a lot of good things done when we do this together. And that is our mission, truly, here at the city. If I just hit enter to forward this thing. Yeah, right. I did good. If you prefer to use this. Nah. Forgive me, you do have a senior up here. I want to give you a snapshot of some of the design guidelines that we have right now. Some of these you have heard ad nauseum, and some of them you have heard them in such a way that probably make you mad. You know, I'm tired of hearing this. What about that? I want to stop at one in particular that has been a point of frustration. I call it the Green Book. Forget the date, but go to the 2018 AASHTO Geometric Design of Highways and Streets for just a minute. A la the Green Book that has generations on a pretty regular basis. The production of that book, the latest edition, was stopped by one of the deputy commissioners for one of the Department of Transportations, simply because it did not address multimodal. It did not address what we are about here. He stopped it, sent it back to the committee and says, we can do better. If you ever get the chance to sit down with him, there's a couple of quotes you're going to hear. I'll pick up on what Ellen said. Not everyone can afford a car these days, but everybody has two legs, Carly, two wheels. Our bicyclists, they've got that. And we've got to make sure we're taking care of them. The second thing that he will say is that no one should die because of a mistake. Deputy Commissioner, Department of Transportation. By the way, that's not North Carolina. That's not Washington. That's not Oregon. That is not Alaska. That is the state of Tennessee Deputy Commissioner. Those are his words. And those are the things that he is instilling in his staff. That is why changes are being made to Chapman Highway to address many of these things that we're going to be pursuing as part of this Vision 1 effort. Some of the improvements that we have been about, roundabouts, my previous firm probably put one of the first that got a lot of attention. That was at North Shore and Concord. And needless to say, there are teeth marks in my posterior because it was not a popular effort. Now it's one of the most popular things that we have in this city, and it's going like a wildfire. Lower speed limits, you've seen our efforts on that in the past 3 months to be able to have the authority to lower speed limits to what they should be versus what is mandated by an ordinance. Traffic calming, our Office of Neighborhoods in conjunction with engineering, what they've done is remarkable. I'm going to speak to that in just a minute. Rumble strips, road dots, median barriers, y'all had a flavor of that. Hopefully you're seeing a more proactive effort to make these things happen. Minimum speed limits. If this wasn't my slide, this would be Dr. Cooley's slide, because she spoke to it best at council. Look at the difference when we start being able to reduce speed limits. And yet our hands were tied before council took the appropriate action to give us the flexibility to address specific situations. Neighborhood traffic safety program. I'm gonna let you look at the numbers since 2018. Then I'm gonna take you down to the bottom where we're gonna have 180 more speed humps that are gonna be approved tomorrow night as part of our repaving contract, so that those will take place prior to November of this year. I wish I had the exact number, and I'm gonna look at my friends from the Office of Neighborhoods, but I believe we've gone from $250,000 when I first came on board to, I believe we had either $1 or $1.5 million for this effort. That's not me politicking. That is a credit to the engineering staff and the neighborhood staff, to our administration and council for supporting those efforts. That's a big, significant jump. Modern safety analysis. In the past, there had only been probably one rule of thumb. We look at the 75 percentile, and then we check to see have there been any conflicts. Our profession is learning. Our profession is opening up its mind to there's more than just cars out there. And this, I hope, begins to give you just a snapshot of what's being looked at. There's a lot more out there that must and is being considered right now. Pedestrian projects, you're seeing a change in them. We're focusing on our crosswalks, our curb ramps. Keep in mind how old this city is. And much of our transportation infrastructure is equally old. And many of our sidewalks and our curb cuts go back better than 10 years at a time when the standards were different. We're all learning, and we're consistently addressing that. And if you look at the administration's budget to deal with this, it is a priority. But I also want to give us a reality check. For the sidewalks that have been looked at and put into the sidewalk study, if we wanted to do all of them today, it would take $1.5 to $2 billion to make that happen. That's a B, not an M. And so we have to be cognizant of what can be done. Therefore, we have to be proactive in our prioritization. You're going to see more audible push buttons at our schools. Quite frankly, the kids have got my heart. And if I hear something that we have an issue at a crossing at one of our schools, that will be dealt with. That's our staff's heart as well. They are on top of it, and none of this happens because of me. It's really them who are making it happen. I want to show this project off. John Livingood is here. This is one that came up, I want to say, about 1.5 years ago, where many people who use the Hill Avenue corridor were very frustrated for the speeds that were taking place on the viaduct. And they were right. If you went out there and watched it, it'd blow you away. It was like an airport runway. Systematically, things have been chipped at. What you're seeing in this photograph is what has been done by his and the staff's creativity. And if you happen to get in the city-county building, and if you can get a window that faces this direction, watch the traffic. It is a blast. When that red sign starts flashing and saying that they're speeding, the brakes come on. And that includes some city vehicles and maybe a cat bus or two that slows down. It works. It is working. Long-term construction projects, these take more. But you're seeing our efforts to try to address more and more of these intersections. Let me do a sidebar for just a second. Tomorrow morning, we are sitting down with Ellen's data. And I'm not going to say the first time, but it's the first time that I'm aware of. We're literally looking at where there have been conflicts with vehicles, pedestrians, and or bikes. We must look at all of that. And so if a vehicle conflict stands out, we've got to look at that. But we're systematically going through the city. We're starting this just as a starting point, 5 to 6 spots in a given council district. Now, once we look at it that way, it's probably going to bubble to the top where the priorities should be, irregardless of council district, because accidents do not know boundaries. But that's beginning tomorrow so that we can then begin this effort of long-term construction projects to address those needs. It does take money. Unfortunately, one of our sources of money, the TIP program, basically has a freeze on it right now because of how construction costs have gone up. That's not just for us. That's for all of the folks who are in our TPO area. Active safety improvement projects. This list goes on, but let me encourage you to take a look at something else. Take a look at the capital improvement plan that's going to be considered tomorrow night. And you'll see that there is more things happening, more good things that are happening in spite of budget limitations that we have this year. Before Lieutenant Debeau stands up, I want to go back to something that was said at the very beginning, and that is, I think it's pretty cool. If I wrote the numbers down right and hold me accountable here, there were some communities that saw 30 to 40% reduction. That's pretty neat. That's not good enough. I'd like for this community, and this sounds like salesmanship, but I'm too old to do that. I'd like this community to set the benchmark for other communities. If we can't cut that 50 number in half, we ought to have our tails kicked. And that is my hope of what comes out of this group. There's some things we cannot prevent. There's some people out there who will act stupid. It's not just a mistake, they're intoxicated or whatever. Those are the tough ones to deal with. But I gotta believe that half of the number that Ellen had on this side of the ledger, surely to goodness, in a quick amount of time, pulling together, we can get that down to half. That's still not gonna be good enough, but at least that's a good start. So thank you for putting up with me, and Lieutenant, it's all yours.
Thank you, Harold.
My goodness, that's a really hard act to follow right there. Guys, there is nothing more that I would like and prefer is to not have my phone ring in the middle of the night to be called out to a fatality. We have 4 teams of reconstructionists at KPD, and we rotate, and I can tell you, I speak for each one of them, there's nothing more that we would like for there to be 0 fatalities in our city. Having to get up in the middle of the night to respond to a serious injury, because we respond to those too, because they may result in a fatality, or to a fatality, you know that that's someone's child, that's someone's husband, sister, mother. That's not something that we take lightly. And when we get there, we try to collect as much data and information about the whys and the causes of those accidents. That's just what we do. But at the same time, for law enforcement, it's a bit frustrating. For us right now in Knoxville and across the United States, our numbers are down. And now we as officers find ourselves, instead of being able to be on that enforcement end, to be out there running radar, doing traffic enforcement. We've got officers that are running from call to call to call, working 12-hour shifts. We have programs that are funded through the Tennessee Highway and Safety Office of grants. We have 2 wonderful ladies at KPD that do a great job in getting us grant money. But these officers, it's a secondary employment. So these officers, after working a 12-hour shift, it's real hard for them to go out and run another 5-6 hours for DUI or traffic calming. And the money usually doesn't get taken up. I mean, I don't think we've spent our entire grant money funding in the last few years, and that's a sad state of affairs for us to be in, because the state obviously believes in those programs and they're willing to invest in them. We just don't have the manpower right now. I have requests daily where people call in about traffic in their community and their neighborhoods. And we do our very best to get out there and address those. Unfortunately, that's our frustration when it comes to the law enforcement side, is that we're down in numbers and we're doing everything that we can to get back there. American Cannon has probably done more for city employees than the past few administrations, and I applaud her for that. Some of my data is just kind of redundant. These are just, Ellen does a great job of keeping up with the fatalities, and these are just numbers from our first quarter of 2022. I knew she would have a bunch of the other numbers for the past years. Being a part of the panel that she's on, it's really eye-opening. We work hand in hand with traffic engineering. Some of the community members come out. The Tennessee Highway Safety Office comes out. So these are just, it's just some numbers, some data just for our first quarter here on just kind of our traffic summary. You'll see where there was fatalities for January, February. Over here is just the percentage of the differentials. But it breaks it all down, whether it's an injury on a bicycle, a motorcycle. Headed in today, we had another serious accident involving a motorcycle. It all comes down to enforcement and education. And one of the challenges is right now as law enforcement, we can't be proactive because we're just being reactive heading to these calls. We can't change human behavior as much as I would love that to be the case. But like Ellen was talking about, a lot of these fatalities, serious accidents, come from persons who choose to drive under the influence. We have a DUI grant. We have officers who work overtime, and that's their main focus. But a DUI stop will take an officer out of service for about 4 hours. By the time you make the stop, you make the arrest, you get the blood draw, you do all the things. It's very time consuming. We do traffic calming where we have people who call in and see an increase in speeding in their neighborhoods. That goes on a list of neighborhoods throughout the city. But again, that's a secondary job. Officers have to sign up for that. There's no guarantee that that will be addressed. I try to send those to the districts. We have district commanders, Captain Susan Coker, who's over the East District, and Captain Brian Evans, who's over the West. So we always make them aware. And then their officers try, as time allows, for that to be addressed. So again, this is just some more data just from the first quarter there. This is DUI collisions, just from January through March. What our crime analysis folks try to do, their database strategy is some of the roadway segments. So what they try to do is look at the roadway segments that maybe hasn't been on our radar before, that have more than like 2 or more collisions occurring in that area, to see if there's something that we or traffic engineering can address. And we go over a lot of that in the meetings that we do once every 6 months. So some of the programs, we've just gotten a funding for a DUI trailer. So we hope to, in the future, be partnering with THP to do DUI checkpoints. Again, that's something that we'll have to partner with them to do, and they're willing to do that for us. We've done our distracted driving initiative with THP, and that is a huge, huge part of some of the issues that we see with accidents. It's hard for us to prove somebody's been on their phone unless they give us consent to look at it. Usually in a fatality, those things are taken in, and we try to look at those. But distracted driving is pretty much almost at the top of there with DUIs. Kids today, I have a teenager. I have four kids that drive on the roadways. So I'm very invested in making the roadways safe. Just a quick story. I pulled over a car one day. It's a teenage driver. Walked up to the car and we always say who we are and the reason for the stop. It's a young teenage girl. Told her my name, why I stopped her, asked for a driver's license, proof of insurance, all the things. Go back to my car. I write her the citation because she's a teenage driver and she has one too many people in her vehicle. And if you have teenagers, you know that there are restrictions. And there's a reason why. So I tell my 16-year-old, the reason why you can't have more than one person in there. Well, that young lady got the citation, and I said, you're going to have to call for a ride for one of your passengers. Which one do you want to call? And I said, wait a minute, I'll make the decision real easy for you. My son was in the back seat. So we eliminated that passenger really fast. So, it's the challenges that we face as law enforcement is the buy-in, the parents making the tough decisions to get their kids in a program about defensive driving. We at KPD have one of those. A lot of the programs in the school system I don't know about you guys, but I'm a senior too. I had driver's ed in high school. A lot of schools don't have that anymore, and that's a shame. But we at KPD do offer, it's called TRACK, and our training academy has the information if anybody's ever interested in that. But it's about us trying to educate and change human behavior. It's about other people taking responsibility and the buy-in and getting that done. Senior drivers, that's kind of a challenge for us as well. It's a hard thing to roll up on an accident that's involved a senior driver and then send that person to be retested. Trying to take somebody's driving privileges away. It's a tough thing to do, but sometimes it has to be done. But there would be nothing better in my life if I didn't get that 3 a.m. phone call to be called out to a fatality. And I can speak for every law enforcement officer in my department. That's the last thing we want to do is go knock on someone's door and tell them that their loved one is gone and that they've been involved in a motor accident. So we would just hope that we continue this panel, this program. I'm behind it 110%, and I know the department is as well. We find out a lot of good things. I'm able to talk with traffic engineering. When somebody comes to me, I can call Harold's office. The guys there are wonderful, and we can try to find a solution. Ellen is a wonderful resource. We're just really trying to make this a better place to bike, walk, run, drive, and we can't do it alone. We have to have your help, and I appreciate your time.
So I want to make sure we've got plenty of time for questions. Grace, if we got any through the online platform, great. So to make sure that we've got plenty of time, I'm going to put this up here. We tested with phones, so if you've got Google Lens or something like that, we've got a brief survey that you can take, so I'll leave this up so you can snap it on your way out. But I want to make sure that you all have an opportunity to ask questions to our panelists, anything that you're interested in. So, Jay?
Yeah, citizen question. So you mentioned costs, and obviously that's a huge issue, but what about passing some of those costs on to developers so that they're required to pay infrastructure costs for the development, for sidewalks, for safe streets, etc.? Is that something that's happening in the city and the county?
So the question for those that might be listening in are what costs might be able to be passed on to developers or things that could reduce the high cost.
Which one?
We'll set this down. That's for Sean.
We're already there. There are specific requirements for developments related to sidewalks, related to the roadway section, that they must implement and that they must own the cost for. Now, there's the rest of the story. and that is the standard subdivision roadway width is 26 feet right now, which is wide. Pretty good if you got on-street parking. Then in a lot of these developments, we don't have that. That is something we're working with the Planning Commission right now to revisit, to see what should acceptable roadway sections be. And right now, we have one size fits all. That doesn't work. That just doesn't work. So yes, they are required, and what we want to do is begin to tailor those requirements to fit the specific application of that development. So stay tuned, it's coming.
Thank you, Harold. Thanks, Jay. Other questions? Please.
I have a question about how certain policies and laws that the city currently has, are there any that would change over the years to better move forward with the Vision Zero? Say, for example, we have problems with car dependency and car infrastructure. Like, say, for example, the city still has parking requirements or parking minimums like in downtown. Would anything like that change in the next coming years? Or is that something we're going to keep?
Yeah, Harold, Ellen, which popular?
The answer is yes. We already took a significant step when Recode went into place. There are some communities that have gone with zero parking requirements for development in the downtown area. What they're finding is that's not practical, but at the same time, the old formula for parking was creating too many spaces. Now, here's another rest of the story. Forgive me for using that phrase. We had a request come in through planning that a neighborhood wants to increase the required parking by a significant amount. And there's been a pretty good conversation between our office, economic development, and planning on this doesn't feel right. I think the most encouragement that I could have personally, and I would love for Ellen to speak to this, on heading in the direction that you mentioned, is going to be education. We have to show that our public transit system is not that bad. In fact, it's pretty strong. And educating folks that there are options to having so many vehicles. That's in what I would call the urban setting of our community. We've got two different settings in the Knoxville community. We have the urban, the downtown, but we also have the rural. And as you move further west, east, what those look like are different. So I'm anticipating we may see more flexibility in the parking standards as well to address specific uses. That just feels like where things are headed. But she's a better expert than me.
I don't know about that, but I'll take a stab at it. I think you know, like Harold said, the parking standards were tightened up with Recode. There are even some parking maximums in place. And I think really looking at, you know, where the parking is situated, you know, you shouldn't, you know, obviously if you take public transit somewhere, you shouldn't have to cross a sea of parking to get to the front door of that grocery store. That's an inconvenience. That's a dangerous situation. And it's really, you know, it's really driving people to feel the need that they have to drive everywhere if that's the only convenient, safe way to get somewhere. So, you know, continually looking at those parking standards is a huge thing. And again, at the safety of parking lots, you know, we have a lot of data on this, but, you know, parking lots are a really dangerous place for people to walk, whether they're walking from a bus stop, whether they're walking from the neighborhood, whether they're just walking from the far end of the parking lot where they park their car. So how do we design our parking lots so that, again, they're as compact as they can be, they're situated in the right place, they're not a barrier to people walking, and they're not a barrier to safety. I think, you know, it's one of those like planning minutiae that a lot of people don't think about, but it is really important.
Also, can I offer one example of encouragement? And that's the stadium itself. The administration and planning required the developer to evaluate, do a parking study of what was available within a certain radius of the stadium and to make sure that parking was being utilized. In the midst of that, there's been enhancements that will go into place where you'll have an app and can find public parking much easier. That's a huge step. Whereas not too many years ago, you have a stadium, you have this many seats, you've got to create this much parking. They took a different approach, and that is they're saying, let's see what we've already got to reduce some of that sea of asphalt. So I hope that's of some encouragement to this group.
Thank you, Harold. Thank you, Aaron.
I'm from the UT parking office, and we have a significant problem with parking on campus and off campus of not having enough availability in the Fort Sanders neighborhood, especially when we've had significant development going on with the new buildings coming in and transit-oriented development. That the students don't understand that if someone's building 120 units, they might have 120 spaces, but they've got 480 kids. And the kids are assuming that, oh, they can just bring their cars, and now they are stuck trying to find, and there is trying to find parking availability in the Fort Sanders neighborhood, and they want to park on campus in the commuter spaces. We can't let them do that, because then we have no spaces for the commuters when they're trying to come on and off of campus. And so we're in a conundrum, because I think the university is, we've had an increase in the number of out-of-state students that are bringing their vehicles. And changing that car culture is very, very difficult. And on the other hand, I work with CAT quite a bit, the bus system, and they're strategically looking at what they can do and where they should be serving, because they could serve a tighter group of a higher concentration of people, or they could serve a breadth of the community, but they can't do both. And so it brings up a conundrum of, how do we, and we've also got the kids that are coming to school that have no intention of ever having a car, so they have never had that education about this, or pedestrian safety. They just only look at their phones and keep walking, And I think that UT's done a great job in the last 6 years that I've been there with traffic calming devices. They are actually crossing at crosswalks, which is like astounding to me.
Except for ball games, they don't.
Except for ball games. And
They're kind of weak.
concerts.
Yeah.
And concerts, yeah.
Yeah.
But how is there able to be a conversation between the developers, the Fort Sanders neighborhood, the university, of what's strategic things we can look at doing to help educate our community, and to, because we really don't have very much space on campus to even build more parking. And I personally don't believe that we should be. I think that we should be doing more commuting solutions, but that's really hard to change this traffic culture, even among staff and faculty.
Yeah, so I'll say one thing. Obviously, we want to make sure that we promote opportunities to get involved through Vision Zero coming up in this fall.
Right.
That way we can air some of those safety concerns, especially around the density and how people get to and from, whether it's commuting or walking once they get to the Fort Sanders or a parking garage. Harold, did you want to weigh in on any other engineering solutions in the Fort Sanders area?
No, I was going to let the lieutenant weigh in on the engineering solutions.
No.
The good news, UT is undertaken a significant master planning effort on its campus, and we have a tendency to think of campus in a small fixed area, but they have broadened their scope across the river in hopes that this pedestrian bike bridge becomes a reality out towards Alcoa Highway, into the Fort Sanders community, and even into our downtown area. And they were gracious enough to invite Deputy Mayor Brace, Stephanie Welch, and I was their driver that day, so I got to sit in on what they're thinking, and it was a great dialogue that was taking place. There wasn't an answer on parking yet. It is front and center. Take the education and the research component, make that front and center. We've got to get the students and the faculty there too. So that has to be a critical component. One of the things we're looking hard at is looking at the Sutherland Avenue corridor as far as folks living in that area. One of the first projects that I got hit with that is on our priority list is the Tyson-Fort Sanders connector for bikes and peds. And that is becoming a reality. Now, reality because of its cost, it takes time. But you can see it very clearly that it's on the capital improvements list so that possibly students coming from the Tyson side of the campus in the Fort Sanders will be able to bike and walk, where right now that Cumberland Avenue pinch point at the railroad viaduct is not grand. It's not grand at all. So we're hoping to create a more safe pedestrian bike access there. I think we need to let the university's planning process go forward. I think some of that needs to be brought into this Vision Zero discussion. I can tell you that it's very, very important, all involved, including us, the city, that we're able to create more opportunities there.
Thanks. Thank you very much. I forgot to say what my role is. I'm actually the communications manager for parking and transit. So I'm the one that goes out and helps to do the outreach and calls our partners around the city and stuff and says, what do we need to do and where do we need to do it? So thank you very much.
Thank you, Maura. Jay, I know you got a question. We've got one that came in online, and then we're at time, so I'm going to wrap. And whatever question that any of you have, I'm sure our panelists will be wrapping up a little bit here. Feel free to come up and ask a question. If you're online and viewing and you have a question, shoot it to us. We'll make sure to get a response posted as follow-up. So question came in on Slido. How does Vision Zero address micromobility and safety of people who use scooters? So one of the fundamental aspects of Vision Zero is considering all users. So whenever we do any sort of public outreach, we're going to work with scooter vendors to make sure that we push information out through the apps so that they can advertise to get people to weigh in, scooter users. And as a city, we've made policy decisions to try to keep the scooters with the other bike ped sort of facilities. So any improvement, any connection that we make related to bicyclists in particular, obviously that is accessible to scooters. So we'll be soliciting more information about people's concerns and their different modes of transportation. That way we can put a little bit more nuance in the plan as we go forward. With that said, I want to thank our speakers once more. And thank you all for joining us. If you haven't already, queue up the survey, take it for us. Our next meeting with Vision Zero will be a steering committee meeting June 20th, so next month coming up. So we'll be here as we wrap up. Thank you again for your time. Have a great afternoon.